People, if they cook a lot, their face is over the pot, so they have a lot of steam coming on their face. That can also trigger and flare your melasma. Welcome to DC Dermatology Skin Truths. We're right in the middle of summer, and I get lots of questions about brown spots during this time of the year. So today we're going to be reviewing the most frequently asked questions in my office when it comes to pigment correction.
What are other things that can cause melasma flare-ups besides necessarily like sun exposure?
So a lot of things with in terms of melasma, heat is a big trigger. So if you're doing saunas, if you love to be in your jacuzzi, your hot tub, if you love the steam room, if you love hot yoga, hot Pilates, that is actually going to trigger your melasma because of the heat. We're also seeing a lot of data on red light therapy causing flares of your melasma. So a lot of people do that for anti-aging benefits, but actually it is flaring their melasma. And then lastly, cooking. You'd be surprised. Some people, if they cook a lot, their face is over the pot, so they have a lot of steam coming on their face. That can also trigger and flare your melasma.
Next is, I did a pigment correction treatment and had great results, but now I'm noticing that my brown spots are returning. What are the next steps that I can do?
So in this case scenario, I always go over a lot of lifestyle modifications and habits that you could change in order to help maintain your results. No matter what, there are going to be times when you're going to need maintenance. So whether that's a chemical peel, that's another round of laser treatments, it really just depends on each person as well as their lifestyle. So number one is, how good are you with SPF, and are you using tinted sunscreen? Number two is, are you going on a lot of vacations that involves the beach or being out in the sun a lot? Because that can also make the brown spots return. Number three, if you have melasma, hormones can also flare the condition. And that we see a lot in women who are on birth control pills, pregnancy, or even patients who are on hormone replacement therapy. You can see a flare of their melasma because of that. So lifestyle as well as good topical usage is very important to maintain the results.
What are some over-the-counter products that can help with my brown spots?
Okay, so great question. You know, when it comes to over-the-counter medications that I usually recommend, the first thing is to know what the diagnosis is. So this is why the consultation is so important, because it allows me to see the skin so that we can tell you what's going on with the brown spot. But in general, when it comes to over-the-counter, I usually say number one is SPF. I love tinted sunscreen. I think that's going to be really important for maintenance and just preventing UV sun damage to the area. Number two, vitamin C serum. That's a great thing to add in, especially in the morning before your sunscreen. Number three, another option is azelaic acid. That's over the counter as well as prescription. And then you also have retinols. You know, the stronger versions of that is going to be prescription based, but retinols can help to lighten the skin.
What is the difference between tinted and non-tinted SPF?
So with SPF, tinted SPF usually has iron oxides in it, and that is really, really important because the iron oxides will help block visible light as well as blue light that's coming off of the screens, phones, and things of that sort. So when you're treating pigment, it's really important to do a tinted SPF over a non-tinted version.
Is there kind of a standard one that I should be looking out for?
So any type of sunscreen, whether it be mineral or chemical, is fine as long as you like to use it. But I will say that most patients tend to have some sensitivity to the chemical sunblocks. So I usually recommend mineral sunscreen, and it's tinted for those that are going through pigment correction treatment. I also like the mineral tinted because it lays on top of the skin, so it's reflecting the UV light, versus with the chemical, it is being absorbed more in your skin, which is fine. But then this is where some patients may feel like when they're sweating and they're getting sunscreen residue in their eyes, it starts to get really itchy. Or patients who have very sensitive skin, like they have eczema or just aren't able to tolerate a lot of chemicals, then the chemical sunscreens would not be as tolerable.
What is the best time of year to do pigment correction? Can I do it in the summer?
Any time of the year is fine for pigment correction clinic as long as you are good with your sun protection. So that means if you want to do it in the summer, just make sure you're not going to the beach right after. You're not planning a big trip to Disneyland where you're going to be outside all day. If you are planning on doing it in the summer, just have a really good plan in terms of how much sun you can avoid. You don't have to be away from the sun entirely, just practice really good sun protection. Make sure you're wearing a wide brim hat, sunglasses, and reapplying your sunscreen, tinted sunscreen, twice a day.
How can I tell the difference between what is a sunspot versus what might just be an acne scar, or even like different types of skin conditions? What are some like differentiating signs they can look out for?
In general, this is going to be something that, your provider will talk to you about in person. However, when it comes to acne scarring, you'll notice that whenever you have a bad acne flare where it leaves a light tan mark, that's usually the acne scarring that's temporary, meaning it's going to fade over time, and that's the discoloration from that inflammation. In terms of sun freckling, people will notice that it's been on their skin for a while. They've maybe noticed it 10 years ago, 5 years ago. It kind of developed over time, and it usually stays about the same size and usually located on areas where there's been a lot of sun exposure. And then lastly, another big thing is if you have any kind of brown spot or what you think is a sunspot that appears to be changing, meaning getting darker, getting bigger, causing symptoms like bleeding or weird itching, then that is a sign for it to get checked out, because sometimes certain types of skin cancers can behave like that. If I would say the three truths for pigment correction, number one would be the diagnosis. You want to go to somebody that's going to be able to tell you what exactly is causing your brown spots, because the treatment for melasma versus a sun freckle versus an age spot or a skin cancer can be very, very different. Number two is the treatment's going to change. For some patients who have darker skin types, we have to be a lot more careful when it comes to laser settings. You can't just use the same settings for every single person. So that's going to be very delicate and could change based on the type of pigment as well as the type of skin color that they have. And then the third thing is lifestyle. So just because you complete pigment correction doesn't mean that all is done. You want to make sure you're using your sunscreen, sometimes up to twice a day. You want to make sure you're good with your topical treatments as well as prescription recommendations, and then also avoiding any of the triggers that we mentioned today. If you enjoyed today's episode, please subscribe, leave a review, and share the podcast with someone who might find it helpful. This podcast is intended for educational and informational purposes only. It is not meant to replace medical advice, diagnosis, or treatment from your own healthcare provider. For additional science-based dermatology information, visit aad.org. To learn more about our dermatology practice, visit www.dindermatology.com.